all over. I'm here today to talk about our pre-diabetes program. It's not diabetes, it's a pre-diabetes program. Now, I do a diabetes education as well, but this program that we are kind of kicking out to you is all on prevention of diabetes. So I work with people both that have diabetes. Probably, I think the most fun part of my job is prevention and trying to keep people that might be at risk for diabetes to keep them from getting there. So that's what this is all about. Sometimes when I meet with clients at the very beginning of their stage of changing lifestyle, the conversation sometimes goes like this, and I might need Debbie's help. But this is kind of how our conversation goes, if it works.
Hello, it's me. I've avoided you forever while consuming calories. I love donuts, mac and cheese. They say kale is antioxidants, but I'm anti-leafy green.
Hello, can you save me? I'm in calisthenics dreaming about Netflix and Mickey D's. When I was younger, these jeans used to fit me. Now my booty's got them bursting at the seams. There's more circumference to my gut and no gap between my thighs.
Hella cravings for some fries. How did one push up and I cried? And my glutes are shaking every time that I lunge. And this gluten-free bread tastes just like a sport.
It does.
Have pizza late at night. I keep saying just one more slice, and I feel so hungry. Breakfast, dinner, and lunch, and the ice cream truck is the only reason I run anymore.
Okay, you can share it off. You know, we laugh at that, but we can all relate to some parts of that, can't we?
Sure.
Yeah. So again, the focus of this program is all about preventing type 2 diabetes. Studies have shown that the most effective way to prevent type 2 diabetes is by lifestyle change. But that's not easy, and it doesn't happen overnight. It took you a long time to get out of shape. It doesn't happen just like this to try to get back into shape. This program is research-based. It's proven effective to delay type 2 diabetes by about 60%, which is pretty darn good. Even after 10 years, studies have shown people that complete this year-long program had a lower rate of converting to type 2 diabetes. So let's talk a little bit about what prediabetes is. Does anybody know in here if you are pre-diabetic? So you know. Okay. What exactly it is it's when your blood glucose readings are higher than normal, but they're not high enough to be diagnosed with diabetes. So it's a good thing because we know that you can prevent type 2. It's a huge problem in our nation. I think it obviously it correlates with our obesity rate. We're fluffy around the middle, and women especially, as we get older, we tend to store our fat right around the middle. 1 in 3 people have prediabetes, and that trend is continuing to increase. Nearly 90% of people that have prediabetes don't even know they have it. They're totally what we call asymptomatic. And the bad part about that is if they do nothing, their risk of progressing to type 2 diabetes and heart disease and stroke only increases. So if you don't know you have it, and if you do nothing, you're going to develop type 2 diabetes. So we want to heighten awareness, and I know Union Bank does screens So it's really important that you pay attention to that screening and just, look at the results and decide if you're in that category. Without intervention, if you have prediabetes and you do nothing, 30% of those folks that have prediabetes will go on to develop type 2 within the next 5 years. So it's not something that just goes away if you don't do anything. You need to change. What is it? It's when your lab values are, and it'll say glucose on your lab value, 100 to 125, and usually it's flagged that it's high, or an A1C test, and I think you do an A1C, don't you?
Yeah, if the glucose is high.
Is high, then they automatically do it. So the A1C test is a blood test that's done to give you an average of what your blood sugar's been over the last 3 months. If that A1C is between 5.7 and 6.4, you have prediabetes. Sometimes your doctor may tell you when you go into the doctor's office, you're kind of borderline. Your blood sugar's a little high. We're just going to watch it. There's where you need to say, no, I don't want to watch it. I want to do something about it because I want to prevent having type 2 diabetes. You can self-identify by a diabetes risk test, and I have those up here. It's basically 7 yes or no questions that kind of can help you self-identify. Questions like, are you overweight? Do your mother and father have diabetes? Do you have a family history? That kind of thing. So if you're very interested on a self-risk test, we can go over that. Moving forward, what are the risk factors? So let's talk about that a little bit. What puts you at risk for developing type 2 diabetes? Some of the things you can't control, obviously your age. The older you get, the higher your risk is for developing type 2 diabetes. Family history, and those are things you can't control. Can't choose your parents. If your mother, father, grandfather, grandmother have type 2 diabetes, puts you at an increased risk. Certainly things that you can control, if you're overweight, if you're a couch potato, that certainly puts you at increased risk. Ethnicity, African American, Hispanics, Pacific Islanders, we see a lot of Indians lately in Sioux City and up in that neck of the woods. They see a lot of ethnicity problems with prediabetes. But the good news is that if you have prediabetes and your lab values are there, you can prevent it, okay? And that's what I want you to know. I think of this risk factor business of genetics. I'm sorry, can you not see? Genetics loads the gun. Genetics meaning your family history loads the gun, but your environment pulls the trigger. Boom. Pulls the problem. Environment of sedentary lifestyle, putting things in your mouth that don't go there. Those kind of things. So, who's eligible? Participants have to be over age 18. That's usually not a problem. You need to be overweight, okay? Your BMI greater than 24, but at high risk of developing type 2. So you have to have those risk factors or laboratory data that shows that you are pre-diabetic. If you didn't hear me the first time, the most effective way to prevent type 2 diabetes is lifestyle changes. What does that mean? Here's the 2 program goals that we really follow in this program. 5 to 7% reduction of weight through healthy eating. Healthy eating, it's mindful eating. It's teaching you what are better choices. If you have the choice of eating this or this, what would be better for you? Doesn't mean we'll always choose it, but helping you decide what would be better for you. For years, when my kids were little, we would drive through Burger King. And I have high cholesterol issues, I thought the best choice for me would be a grilled chicken. Trying to eat healthy, grilled chicken. And years later I looked at, and I'm a nurse, but years later I looked at nutritional value and I could have had a cheeseburger for less fat. So that's one of the things that we do in this year-long program is help people decide what is a better choice. We teach them how to count fat grams, how to eat mindfully and not just stuff the food in our face very quickly. And then obviously it's a 2-pronged approach. It's eating healthy, but then it's also being more active. gaining up to 150 minutes per week of physical activity. Now, not right out of the gate, because if we take somebody that is sedentary to 150 minutes too quickly, we'll see injuries. So we work at this very gradually. Every session we weigh in, and we do ask you to report your intentional physical activity for the week. Okay. It's a commitment because, like I've said maybe 3 times, it is a year-long program. You attend weekly meetings for the first 12 weeks. The first 6 months of the program is what we call the core phase. And we meet about weekly, and then about week 12, we go to every other week. So pretty intensive. Then the last 6 months, we kind of slow down to every 2 weeks. Last 6 months, but we meet for a total of 28 sessions. Every week you weigh in. You sometimes we look at we have you track your food. We look at your food logs. We talk about that, and then we look at your activity minutes as well. Very, very interactive, and we'll go on to what the format is. It is not a lecture like this, okay? It's more interactive, all right? So you're not just sitting there listening to me talk, which is what I love. It's all about you. It's very participant-centered, okay? Because it's not about me. It's us helping you to get to what your goals are. We are lifestyle coaches, so we facilitate the class with a particular topic involved, and there are many, many topics. So remember I said, and this is a CDC, a Centers of Disease Control, made this program, and so it's not my program, it's their program, and we are facilitating it, and so it's very well done. And there are topics every time, and so the discussion kind of centers around the topic of that week. It's, again, a 2-pronged approach. It's healthy eating, but then it's activity. So it's very, very, very nicely done. Individuals are expected to participate, and we want you to engage, because if you don't engage, we see that people aren't very successful. I put up definition of insanity because a lot of times the patients that we see, they come to us and they want our advice. We talk about what are things that you want to change. And then you see them back the next time and you say, so, how are things going? What things have you changed? And they go, nothing. Really? So I always bring up, what is the definition of insanity? It's when you want a different result, but you don't step out and make any changes. If you do the same thing every day, what's going to happen? What's your outcome? You're not going to get a different outcome. You're going to get the same outcome. So, for instance, if somebody wants to lose weight, you don't do that magically by doing the same thing. You need to intervene and kind of step out of your box and be willing to make change. So we want to take that into consideration. Again, core phase, 16 times we meet. The second 6 months we meet 12 times, so a total of 28 times. And if people participate, I kind of think of this as a hospital. The people that go to the hospital are people that are sick and they need help. You need to show up when things are going well for people. That's great, they're doing super, but that's when people want to come. But when people maybe haven't had the success or they didn't lose weight, sometimes they don't want to come to class. And that's when we need you there, because we can't help you if you don't come. So many times we'll email people and say, we need you, we missed you. What's going on in your life? There's no judgment from us, and we are very clear up front that we're not judging you, we're there to help you. So obviously success rates are better when we get people to come. Okay, what can you expect from this program? We do not tell you what you can eat. Okay, it's not a Jenny Craig, or it's not a Weight Watchers saying eat our food. There are no food substitutes. There are no shake replacements. It's no magic program. It's what we're teaching you is life, how to deal with life, how to manage life, healthy lifestyle. And you hear that buzzword a lot, live a healthy lifestyle. But until you get into the nuts and bolts of it, most of us don't understand what that means is a healthy lifestyle. It's choice. It's the choices you make. I choose to exercise, or I choose to get out and walk the dog. I choose to walk farther away, or park farther away and walk farther into work. So it's choice that determines your destiny. The mentality is very simple. Eat less, move more. Bottom line is, we want you to, if you eat less and move more, what's going to happen? Yeah, lose weight, absolutely. A lot of times what we see is, and we talk about those things, why do we eat? Everything centers around food in our culture. It's a very toxic culture. And, to give you the example of that is people, what do you do when you have a birthday? You go out to eat. What do you do if it's your anniversary? We go out to eat, and then we go to a movie, and we just went out to eat, but then you go to the movie theater and, you smell that popcorn. And your stomach's not hungry, but the popcorn sounds good, and so you eat. So the mentality that we see is people are eating to live, living to eat. We live to eat. We go to a tailgate and we eat, and then we go out to eat after the game, and we living to eat. All of our conversations, what's for supper tonight? All of our conversations center around eating, and there's so much more to life than food. But we want to change your mind of, yes, you need to eat to live. Why do we eat? To fuel our bodies. Just like a car needs gas to be able to function, we need food, but we don't need it all day long. We just need to eat to fuel our bodies. So those are the things that we try to ingrain into how we think. What are this focus? This is just an idea of some of the things that we talk about. We talk about what are the food cues, what cues you to eat. Are you listening to your stomach, or is it the power of suggestion? Somebody has brownies at work. Are you listening to your stomach? Are you hungry? Or is it just that food cue of, boy, that looks good, and you put it in your mouth? We talk about barriers of why we don't get out of the house and go for a quick walk. We talk about stress, because lots of unhealthy habits are driven out of what? Stress. You're worried about something. Something is bothering you. That's a huge, huge thing. And so we talk about how to deal with stress. I'm a Tai Chi instructor, and so we kind of throw that into it and teach people some ways to manage stress, because that's huge. Questions about that? Those are just a few. So cost always comes up, and I'm going to kind of refer this to Debbie. The year-long program costs $375. And then Debbie, do you want to interject of how Union Bank and Trust contributes to that?
Yeah, so anyone can participate in the program, in the community, or employees, that kind of thing. UBT health plan participants can participate in the program, and the bank will pay half of the enrollment fee up front, and then participants pay the other half, but on completion of the program, we'll reimburse the other half. So it's essentially free, but in order to stay committed to the program and to continue going, you pay half up front and then get reimbursed on the back end.
And I think that's really successful, because you have some skin in the game. You want to be successful because you're paying for half of that, but you're going to get it back if you're successful and you complete the program. So I commend you for that. That's very good.
Yeah, and that'll go for plan participants who are spouses as well, so not just employees.
Super. So I want you to know, you might be a negative Nancy and you're thinking, yeah, she says it's a research-based program. It is research-based, but I want you to know a little bit about what we have seen here on our level of what our outcomes have been. One of the things that we are doing is, and you don't really need to know this, but I want you to know because it measures our success as a program. We are working toward our recognition through the CDC, which what does that tell you? It tells you that we are a successful program. So we have 10 requirements that we have to report to the CDC every year. And then we'll be able to have our full recognition, and we're pretty close to that. We've been offering this program since 2015, so we're pretty close to getting our whole recognition. But what we've seen in terms of program success is the first year that we started this program, we saw an average weight loss of 5.6. To be recognized, you have to have a minimum of 5%. So I was sweating it. I went, whew. We met that the first year, 5.6. What we've seen since we've been offering this program is outcomes are getting better. And I think that's partly of we're getting better as coaches on what people respond to. But in October, one of our October 2016 classes, they lost a combined 239 pounds, which averaged percent of their weight loss was 10%. So when people engage and when they really buy into, yes, I want to change. I know they own it. I know I have a problem and I don't want to have type 2 diabetes for whatever reason. And we talk about those things. What is your motivation? Why do you want to participate in this? Because we know that when people are ready to make change, it works. Okay? So in summary, if you have prediabetes, I want you to hear loud and clear that this program is for you. If you do not want to develop type 2 diabetes, this is the program for you. But you have to be ready. It is a year-long program. It's a proven program, and you've seen our outcomes kind of align with that. The program that Brian is committed to offering this program 3 times a year, and we offer it in October, in January, and in April. So, maybe you're sitting there and you say, yeah, I have prediabetes, but you know what, October, I don't think I can do it. Now, I like October. Why? Because it takes you through the hard times. What are the hard times? Christmas, Thanksgiving, Christmas, January. Average, nationwide, we gain weight over those holidays. So when people join in October, this last class, nobody gained weight over the holidays. We did challenges. We have challenges within the group. Maybe we give pedometers, and we keep them on task and keep them engaged. But nobody gained weight, which is a huge thing. But let's say October isn't for you. We do offer it again in January. But the one that's coming up, and I did bring posters, I don't know if you can hang those up anywhere, but there's one that's going to be starting October 18th. It's on a Wednesday from 4 to 5. There's 3 ways to register. You can basically, what we like to promote is your employer, we don't give any of your data out to your employer. So for confidential registration, you call 481-6300 and you can register. Okay, and Debbie or none of your managers even know that you've registered. Now, I do give them outcomes de-identified at the end of the program that collectively you lost 239 pounds. Average was 10% weight loss. That's what I provide to Union Bank and Trust. So you should feel comfortable there. What a great way Union Bank and Trust is investing in your employees, in their employees. They want you to be healthy. And they're investing in you $375 to the tune of that. So that's a good thing. What else did I say? You can register by calling. You can email briandiabetes@brianhealth.org. I do have registration forms here available. Now, some companies just say, you know what, leave the forms. I'll give them to our wellness coordinator. That's not confidential because then she knows you signed up for the program. But if you don't care, that's not a problem with me. Other questions that you might have. Class size is limited, and the reason for that is we want to make sure that people feel comfortable to engage and to share. And when there gets too many people, it's not a very welcoming environment. We like to stay at about 15. So if you're interested in this, we want you to sign up as soon as you can to get your spot. Questions, thoughts? What have I missed?
On the activity portion or the
Yes.
exercise portion, do you give like a, workout for people to do for that week?
That's a great question. Great question. I usually teach the activity portion. 2 of us teach this class. One is a registered dietitian, and she really has the food piece. And you fill out food records, and she overlooks them. She gives you a sticker if you're good. She talks to you about issues that you can change. The activity piece usually I do, and I do stress, and I do barriers, and why you don't do that, why you don't do exercise when you know that it's good for you. We talk about those things. Do I sit down and give you a individual exercise program? No, I don't. But what we want to do is, it's not just exercise, it's just being more active. And so we talk about your motivation. You know, I want to be able to, why do I stay active? Why do I get up every morning and exercise? I want to be able to be a grandma that can get on the floor and play with my kids. And maybe it's taking your kids, maybe you're not as old as I am, but we really push that it doesn't have to be go to the gym and get on the LifeStrider and sweat. No, it's just being more active and putting in more steps. And so sometimes, you know, people will go, we'll have drawings and you'll have a Fitbit, and we'll be able to give out a Fitbit as a prize, so that, you know, we want to encourage more steps, more activity instead of sitting. One of the things that maybe you've seen in the literature, but sitting is the new smoking. Have you seen that? Smoking, we all know, is bad for your health, puts you at high risk. In this toxic culture, we found that sitting is just as bad as smoking. And, you know, I'm guilty of that. Is I go to work, I sit down, and all of a sudden I look up and I go, ooh, it's noon. And I haven't gotten out of my chair once. So we talk about, how do you be more active? Very important to get up every hour, get up out of your chair and move a little bit. So that's a great question. What we really push is, what can we do to make it fun? You know, when I was a kid, we played. When we got home, we played. Where is that anymore? You know, when kids get home, they might play on their iPhone, or they sit and watch TV, and we've lost all of that of, you know, sometimes I think kids don't know how to play. And so we want you to get out and enjoy the nature and bundle up and, you know, first, yeah. So if that makes sense, we don't do a personal trainer type thing of this is what you've got to do, but we're trying to encourage you to dance. You know, one of the sessions I teach country line dancing. You know, get up. We're going to learn the Cupid Shuffle, so that when you go to weddings and if you don't know how to do it, you can join. Instead of sitting there eating, you can get up and join. So we do kind of fun things to engage people, if that makes sense. Yeah. Other questions? I just want to thank you for your time. You know, again, I'm all about, boy, you're only on this life once. Make it a good thing. Enjoy the scenery around you, and live as healthy as you can. Because once you develop the issues, it's not easy. You can manage disease, but it's so easier to be proactive on the forefront and on the front end of just not going there. So if I can help you not go there, that's my desire, is to help you be successful. So in summary, I just want to say, if you have prediabetes, or when you're doing your screens, and look at your glucose, look at your A1C. If your glucose is high, they're going to automatically do an A1C. If you're there, think about this program, because this is going to help you from going on to developing type 2. Does that make sense? All right, thank you so much for your attention. Good luck, and I